Hello, this is Keith Woodmeyer, and welcome to, honestly, I don't remember which number we're on, but this is Lifespan Development, and we're getting ready to talk about adolescence. Alright, during adolescence, the size, strength of the heart increases, blood volume increases, systolic blood pressure increases, and heart rate decreases. An adolescent's heart rate is usually 55 to 105 beats per minute, respiratory rates 12 to 20 per minute, and systolic blood pressure is 100 to 120 millimeters of mercury. Muscle size and strength increase, and bone growth is nearly complete. Most adolescents experience a rapid 2 to 3 year growth spurt that begins distally with enlargement of the feet and hands, followed by enlargement of the arms and legs. Enlargement of the chest and trunk occur in the final stages. Physical maturity occurs at the different times, beginning at age 10 and ending about age 16 in girls, and beginning at age 12 and ending about 18 years of age in boys. Alright. Primary and secondary sexual development occurs during adolescence. Primary sexual development refers to the internal and external organs responsible for reproduction, such as ovaries, uterus, breasts, and penis. Secondary sexual development refers to body changes that are the result of hormonal change, such as voice changes and the development of facial and genital hair. In the U.S., the average age of menarche is 12.5, which refers to the onset of menstruation during puberty. Menstruation, which is the periodic discharge of blood and tissue from the uterus, occurs about every 28 days. Menstruation is also called a period. The onset of a period and subsequent sexual activity increase the risk of teen pregnancy, as well as sexually transmitted diseases. Adolescents have the ability to reason, think beyond the present. They're concerned with the opinions of others. Adolescents develop morals, questioning adults who say one thing but do another. An adolescent wants to be treated like an adult, yet conflicts between an adolescent and his or her parents are common. While the adolescent is developing his or her own identity, the parent wants to protect the teen from harm or something the teen may later regret. An adolescent wants to be treated like an adult, yet conflicts... Oops, I'm sorry. I already did that one. During adolescence, self-consciousness increases, peer pressure increases, and interest in the opposite sex increases. Antisocial behavior peaks around 8th through 9th grade, and hormone surges cause wide mood swings. Peer groups are important to an adolescent, and school is typically the focus of his or her social life. Body image is of great concern at this age. Adolescents continuously compare themselves with their peers and determine if they are normal based on what they observe. This plays a huge role for us as EMS providers, especially responding to a school, whether it's an incident, and you see two ends of the spectrum. You either see one end where the adolescent may not want anybody to see what has occurred, or the other end of the spectrum where they're attempting to seek attention. Other problems that you might run into with along the lines of psychosocial changes, particularly come in mind with cutting of clothes. Removal of clothes and cutting of clothes, as I'm sure you're all well aware, clothes tend to be a status symbol. And clothes can be very expensive, so this becomes an issue. Excuse me. Some adolescents do not adjust well to the demands and responsibilities of adolescence. For example, although many adolescent girls accept menstruation and changes in their body as a matter of course, others are distressed and frightened. Teens often experience an increase in weight and fat distribution during their growth spurt. Eating disorders are common because the adolescent desires the, quote, perfect body, or at least a slimmer one. Some teens respond to the stressors of adolescent life in unhealthy ways, such as experimentation with tobacco, alcohol, and illicit drugs. Depression and suicide are more common in adolescents than in any other age group. Not entirely accurate. The largest suicide rate in the country comes from elderly geriatric males. Between 15 and 17 years of age, the teen cautiously establishes relationships. An adolescent usually knows by the time he or she is, by this time, whether or not they're homosexual or heterosexual. Around the age of 18, adolescents begin to understand who they are and start to feel comfortable with that. An attachment to another person develops, and they may end up forming a stable relationship. Adolescents often show inconsistent and unpredictable behavior, although they expect to be treated as adults. Talk to an adolescent in a respectful, friendly manner, as if speaking to an adult. If possible, obtain a history from the patient instead of a caregiver. Expect an adolescent to have many questions and want detailed explanations about what you are planning to do and what's happening to them. Explain things clearly and honestly. Be honest about procedures that will cause discomfort. Allow time for questions. Give the patient choices when appropriate, but do not bargain with an adolescent in order to get what you need. Recognize the tendency for adolescents to overreact. Do not become angry with an emotional or hysterical adolescent. Adolescents fear pain and permanent damage to the body, resulting in change in appearance, scarring, or death. They may go back and forth between modesty and open displays of their body. Try to have an adult of the same gender as the child is present during the examination, meaning if you need to evaluate a younger female, if a female healthcare provider is available, give them access to do that. Allow the caregiver to be present during your assessment if the patient wishes. However, some adolescents may prefer to be assessed privately away from their caregivers. Peers are a major influence in the life of an adolescent. When providing care, an adolescent may prefer to have a peer close by for reassurance. When caring for an adolescent, do not tease or embarrass them, particularly in front of their peers.